In the last 24 hours, we have identified 1,660 new cases and completed about 18,000 tests. Our positivity rate was about 9.4%. Currently, 1,058 people are being treated for COVID-19 in hospital, including 226 in the ICU. 100% of new ICU admissions were in Albertans who did not have any vaccine protection. Sadly, I must announce that 17 new deaths were reported to Alberta Health in the last 24 hours. My condolences go out to the loved ones of these individuals and to all who have lost a family member or friend to any cause during this pandemic. As with the deaths reported earlier this week, while a small number of these individuals were double vaccinated with pre-existing health conditions, most were not vaccinated at all. I also know there have been many questions about immune response from prior infection. Some people are wondering if they need a vaccine if they've already had COVID-19 and whether having recovered from infection should make them exempt for the restrictions exemption program. At this time, everyone needs proof of vaccine or a recent negative result on a privately purchased test or a medical exemption in order to enter businesses in the restrictions exemption program. The bottom line is that my advice for those who have had COVID-19 remains the same. It is still best for everyone to be fully vaccinated with 2 doses to obtain the greatest possible protection from infection. It's also important to remember right now that with our current high levels of transmission, there is still some risk that anyone, whether or not they have recovered from a previous COVID-19 infection or have received immunization, could possibly be reinfected and potentially transmit COVID-19 to others who may be vulnerable to severe outcomes. That's why masking in indoor public places and staying at home if feeling ill is mandatory for everyone in all areas of the province, and I encourage getting tested if you are showing COVID-19 symptoms.
Our hospitals, and in particularly our intensive care units, continue to experience unprecedented patient demand. As of early afternoon, there are 310 Albertans in ICU, of which 226 patients have COVID-19. We have never ever had that number of total patients in ICU before, never with the prior waves and never in the history of this province. And each day we see a new high. Yesterday alone we had 22 Albertans who were admitted to our ICUs with COVID. The day before we had 23. And over the past 5 days, the average number of COVID ICU admissions have been more than 23 per day. As of noon today, we have 350 ICU beds across the province, which keeps our ICU capacity at 89%. We have added 177 ICU surge spaces, which means that we have more than doubled our baseline of ICU beds. And without those additional beds, our capacity would be at 179%.
Schools are a location that we have looked at, again, the evidence from other jurisdictions, our own evidence from our previous pandemic experience, what other provinces have reported, and what we see is that large-scale transmission in schools is not common, that schools are impacted by community transmission, but are not locations that drive community transmission outwards. And so our current framework that does not require mandatory quarantine, does not require close contact tracing, means that disclosure of individually identifying health information, as would happen if individual case notifications happened in schools, would be a violation of an individual's, again, privacy and their rights under the Health Information Act. So we do have that framework where schools, if they see that there are an increased number of children who are ill because of respiratory illness, again, or teachers or staff, they can work with Alberta Health Services. And in some ways, that is adding an additional layer of protection, because if individuals choose to not get tested for COVID but are home with an illness, they're now counted in the list as being part of that outbreak. And so it's less dependent on needing a test to be a part of identifying where there is an issue. We are, as I mentioned, working with education to determine if there are any adjustments that need to be made to this framework, but there are no other settings right now, aside from continuing care and acute care, as locations where there's a significant risk of transmission and severe outcomes if there should be an outbreak. In those settings, we are ensuring that follow-up takes place to mitigate and to manage outbreaks. However, in schools, again, we are taking the approach that an illness that fits that definition, a respiratory illness, is treated the same way, whether it's someone who's diagnosed with COVID or not, and that additional measures can be put into place. One of the things I would say is that what's been reported in other jurisdictions and reported in the literature about school outbreaks is the highest risk for large spreading events is when a teacher or staff who's infectious passes the virus on to others. And so it's critical that anyone who works in a school environment and any older children who are eligible for vaccine receive the protection that vaccine offers, not just for them, but for those around them, including those who they have the responsibility of teaching and caring for. And that's, again, something that I strongly encourage everyone working in the school system to take advantage of that protection that the vaccine offers.